So let's move on to the next topic. So autonomic system and respiratory system we have already done. Now next topic is kidney. Next topic is kidney, and in kidney for generation 3 beta blocker, labetalol is a drug which is alpha and beta blocker both. So we discussed that labetalol is alpha and beta receptor both. It's a blocker of alpha as well as beta receptor AB. And one more is carvedilol. Carvedilol is a drug which is having four properties. That car is having the four wheels. This has the four properties, that is A, B, C, right? So A is for alpha blocker, B is for beta blocker, C is for calcium blocker, and A is also for antioxidant. A is also for antioxidant. Now let's talk about this topic, kidney. Now we discussed in kidney that we have different portions of kidney tubule. One is known as proximal convoluted tubule. Then we have descending limb of Henle. Then we have ascending limb of Henle. Then we have early DCT. Then we have late DCT and cortical collecting duct. And the last part is medullary collecting duct. Now the medicines which will act in PCT of kidney are carbonic anhydrase inhibitor and mannitol. So carbonic anhydrase inhibitor, mannitol, and there is one more group, SGLT2 inhibitors, right? So the medicines are SGLT2 inhibitors. Medicines are SGLT2 inhibitors. Number 2 is mannitol. Third is carbonic anhydrase inhibitors. So carbonic anhydrase inhibitors, mannitol and SGLT2 inhibitors will act on PCT of kidney. Now mannitol is a osmotic diuretic that will also act on descending limb of Henle. This will also act on descending limb of Henle. Now loop diuretics will act on ascending limb of Henle. Thiazide diuretics will act on early part of DCT. Potassium sparing diuretics will act on late part of DCT. And vasopressin 2 receptor antagonist will act on medullary part of collecting duct. Vasopressin 2 antagonist will act on medullary part of collecting duct. Now if we talk about medicines which act on PCT of kidney, proximal convoluted tubule of kidney, the topic is carbonic anhydrase inhibitors. Now whenever we give carbonic anhydrase inhibitor to a patient, from PCT of kidney, 85% of bicarbonate will be lost. 85% of bicarbonate will be lost from proximal convoluted tubule, and when this bicarbonate is lost from the body, patient will develop metabolic acidosis as a side effect, because we have lost the bicarbonate. So because we have lost the bicarbonate, metabolic acidosis will be the side effect. Plus this bicarbonate which is not absorbed in kidney, this will also take away some sodium and potassium along with it. So bicarbonate which is going out from the body in urine, this will combine with sodium and potassium and take away sodium and potassium along with it. So medicines will cause metabolic acidosis, medicines will cause hyponatremia, hypokalemia, and when this bicarbonate which has a tendency to bind with positive charge, bicarbonate is a negative charge, this can bind with positive charge like sodium and potassium, this can also bind to calcium ion, and because it will bind to calcium ion, this will form calcium stones in kidney. So drug will form calcium stones in kidney, the fourth side effect of the medicine. So medicine side effects are metabolic acidosis, medicine will cause hyponatremia, hypokalemia, and medicine will also result in formation of calcium stone as a side effect. Now where do we use the medicine? Now these medicines which are carbonic anhydrase inhibitor, medicines are not given to lose sodium and water. Try to understand, these drugs are inhibitor of bicarbonate, so they are not given to lose sodium and water, right? Medicines are not given to lose sodium and water, rather medicines are given for losing bicarbonate ion. So in patients of glaucoma, where the aqueous humor is a fluid that mainly contains water and bicarbonate ion. So in glaucoma, as well as if we talk about the fluid like aqueous humor as well as cerebrospinal fluid, CSF. So if I talk about aqueous humor and cerebrospinal fluid, these are the two fluids which contains bicarbonate in very high quantity. Now if I block carbonic anhydrase enzyme, If I block carbonic anhydrase enzyme, then aqueous humor synthesis will not take place, plus cerebrospinal fluid synthesis will also not take place. And therefore, the drugs of this class, like there is a drug acetazolamide. So I hope you know the drug name acetazolamide. Acetazolamide is considered as drug of choice for acute attack of glaucoma. Acetazolamide is drug of choice for acute attack of angle closure glaucoma, and this acetazolamide is a second drug of choice. This acetazolamide is a second drug of choice for raised ICT. So this medicine is second drug of choice for raised ICT and drug of choice for acute attack of glaucoma. Plus acetazolamide is also drug of choice for mountain sickness. Acetazolamide is also drug of choice for mountain sickness. The mountain sickness is due to the respiratory alkalosis. So whenever we go to the high altitude, we suffer from hypoxia. At high altitude, we suffer from hypoxia, and because of hypoxia, patient has to hyperventilate. And when patient has to hyperventilate, then patient will acquire the oxygen, but patient will lose the carbon dioxide. And when patient will lose the carbon dioxide, patient will develop respiratory alkalosis, and that is responsible for symptoms of mountain sickness. So if you take this drug acetazolamide before starting your journey towards mountain peak, then this medicine side effect is metabolic acidosis. The drug will cause metabolic acidosis in your plasma, and therefore the alkalosis, which can happen due to this mountain effect, then that alkalosis will not develop. The acidosis will neutralize that alkalosis. So it's a drug of choice for mountain sickness, drug of choice for acute glaucoma, and second drug of choice for raised ICT. Now these medicines which can cause acidosis are avoided in some conditions where acidosis is already present. So medicines are avoided in some conditions where acidosis is already present. For example, these medicines are not given in patients of CKD because in CKD patients already acidosis is present. Medicines are not given in patients of COPD because in COPD patient already there is excessive retention of CO2. Already CO2 is present in excess, and that will cause acidosis. So in patients of COPD, already there is excess of CO2, and that will cause respiratory acidosis. Also, these medicines are contraindicated. In patients who are suffering from CLD, chronic liver disease, or cirrhosis of liver, because in patients of cirrhosis of liver, if you give carbonic anhydrase inhibitors, these medicines will cause encephalopathy or coma. So because of the risk of encephalopathy and coma, medicines are not given in chronic liver disease patient or cirrhosis patient. Because of the risk of acidosis, not given in CKD and COPD. Plus, if the patient is a known case of sulfur drug allergy, these medicines are again contraindicated. So for contraindications, we made a mnemonic during our lecture, that is CA. CA stands for carbonic anhydrase. So three conditions starts with C, that is CKD, CLD and COPD. CKD, COPD, CLD are three contraindication. A is for allergy. So A is for allergy. So if the patient is allergic, medicines are contraindicated. Three conditions starts with C: lung failure, kidney failure and liver failure. So CKD, CLD, COPD are three contraindication plus one more, sulfur drug allergy. Now the second drug is mannitol. Now mannitol is a drug which is a osmotic diuretic. Now this medicine will act at two locations. This will act at descending limb of Henle, plus this medicine will also act in PCT of kidney. Now how this medicine will act? Now because of its osmotic effect, this medicine is a sugar, and we discussed during our lecture, like if you place the sugar in an open climate, open environment, this will absorb the water. So if the mannitol is given to a patient, this medicine has a tendency to bind with the water. So this mannitol also has a tendency to bind with the water, and when this medicine will bind with the water, now this water is not reabsorbed in the kidney, water is removed from the body. So wherever this medicine will go, this medicine has a tendency to bind with the water, right? Now this medicine's side effects were not important, so we did not discuss the side effect of mannitol. Now, where I can use the medicine? I can use this medicine for the treatment of those conditions where I want to reduce the water quantity. Try to understand, guys. Carbonic anhydrase inhibitors are given in those conditions where I want to remove bicarbonate from the body or where I want to produce the acidosis. So if I want to remove the bicarbonate, I discussed that medicines are given for glaucoma as well as for raised ICT, and because of the acidosis tendency, because medicines can cause acidosis, I can use carbonic anhydrase inhibitor for mountain sickness. But if I talk about mannitol, mannitol is a drug which will only bind to water, no interaction with sodium, no interaction with any bicarbonate. So this medicine is mainly given to reduce the water quantity. So in any of the condition wherever water is present in excess, for example, in the patients of acute angle closure glaucoma. So in a patient of acute angle closure glaucoma, this medicine is given after acetazolamide. So acetazolamide is a drug of choice, and this is given after acetazolamide if that is not sufficient enough to control that glaucoma. So glaucoma mein aqueous humor level is high, and aqueous humor is mainly made up of water, right? Mainly made up of water. Second is bicarbonate. So first of all, you try to control that glaucoma by reducing the bicarbonate, but if that will not work, then finally you have to give acetazolamide that will remove the water, and this will definitely reduce the pressure in your eyes. The same thing applies to raised ICT. So this medicine is drug of choice for raised ICT also. Mannitol is drug of choice for raised ICT, second drug of choice for acute angle closure glaucoma. So just remember, acetazolamide, drug of choice for acute glaucoma, mannitol is second. But for raised ICT, mannitol is first, but acetazolamide is second. Also, this medicine is drug of choice for cerebral edema. Medicine is drug of choice for cerebral edema. So if you give the medicine, this medicine will produce the osmotic effect, and because of the osmotic effect, this medicine will bind to the water present in the brain and remove the water from the brain. But this drug is contraindicated. This medicine is contraindicated in a condition like acute CHF with pulmonary edema. So in a patient of acute CHF with pulmonary edema, this is contraindicated. Now, why mannitol is contraindicated in acute CHF with pulmonary edema? The reason is this medicine can produce the osmotic effect, and if you give the medicine by IV route, this medicine will be present in your plasma. So this will pull the water. This medicine will pull the water from your organ system, and if this medicine will pull the water from your organ system, there will be more plasma volume. So already you have 5 liter plasma. If you have this drug in the plasma, this will pull more water from the organ. Now your plasma volume will be higher. And if your plasma volume will be higher, this will take entry in the heart, and this will put more load on the heart. This will put more congestion in the heart. And therefore, in a patient of congestive heart failure, already there is a hypervolemia in the heart. If you give mannitol, that will put more pressure, more load, and therefore contraindicated. Plus, this medicine is contraindicated in a patient who is having acute cerebral hemorrhage. So in a patient of acute cerebral hemorrhage, this drug is contraindicated because in acute cerebral hemorrhage, the blood vessels are ruptured in the brain. So if you give the medicine, this medicine will leak out from those blood vessels. This medicine will leak out from those blood vessels and enter in the brain tissue. So by leaking out from those blood vessels, medicine takes entry in the structure. Medicine will take entry in the brain tissue, and after reaching the brain tissue, the medicine will produce the osmotic effect, and after producing the osmotic effect, medicine will pull the water from the plasma towards the brain tissue. So when the medicine is present in your brain tissue, medicine will produce its osmotic effect and will make that edema in the brain tissue even more or even worse than the previous thing, right? So medicines are contraindicated in acute cerebral hemorrhage. The third topic is SGLT2 inhibitor. So this topic I will cover in endocrine topic, right? So SGLT2 inhibitor is a third group of medicine that will act on PCT. So this topic I will cover in endocrine. So right now here I will not cover this SGLT2 inhibitor. Now the medicines which will act on ascending lobe of Henle. So medicines which will act on loop of Henle, ascending limb. So medicine that will act on ascending limb of Henle, the drug is known as loop diuretic. The drug is known as loop diuretics. Now loop diuretics mechanism of action is they are inhibitor of a pump known as sodium potassium dichloride pump. Now these medicines are inhibitor of sodium potassium dichloride pump and can result in maximum loss of sodium and water. can result in maximum loss of sodium and water from the body, and these medicines are most efficient diuretics. Now guys, if you want to try to make up your concept, you can make the concept like this way. Carbonic anhydrase inhibitors are mainly given to lose bicarbonate. So wherever you want to lose the bicarbonate, give carbonic anhydrase inhibitor, or wherever you want to achieve the acidosis, give carbonic anhydrase inhibitor. Wherever you want to reduce the water quantity, wherever you want to reduce the only water quantity, not the sodium, only the water quantity, like in cases of cerebral edema, raised ICT or glaucoma, give mannitol. But wherever you actually want to reduce the sodium level plus the water level, you want to reduce the water as well as sodium, then use loop diuretics. So wherever you want to lose the ions from the body or you want to lose the water from the body, use loop diuretics. Now these medicines are the strongest diuretic. So these medicines, when given to a patient, these medicines will cause loss of all ions. So all type of ions are lost. In your exam, you can remember like this way: sodium, potassium, chloride, magnesium, calcium, bicarbonate, hydrogen, all ions are lost. And because the hydrogen is lost, these medicines will cause metabolic alkalosis. Plus, when these ions are lost, when the ions are lost from the body, then the nerve conduction will be affected. When the nerve conduction is affected, patient develops neurotoxicity, ototoxicity, and paresthesias. Right? Apart from that, these medicines can also lead to metabolic side effect, and three metabolic pathways are involved. And there are three metabolic pathways, and all three metabolic pathways are affected. So these drugs will cause hyperglycemia, hyperlipidemia, as well as hyperuricemia as a side effect. Medicines are given to lose the sodium and water. And because these medicines will cause loss of sodium and water, they are the drug of choice for CHF with pulmonary edema. These medicines are drug of choice for CHF with pulmonary edema. Apart from that, these medicines are also given for the treatment of pedal edema. Medicines are given for the treatment of pedal edema, as well as given for the treatment of hypertensive crisis. So medicines are given to lose sodium and water, and where we want to lose the sodium and water, we want to lose sodium and water in cases of CHF with pulmonary edema, in cases of pedal edema, as well as for hypertensive crisis. Now apart from the sodium and water, these medicines are also associated with loss of other ions. Medicines will cause loss of other ions from the body, and because these medicines will cause loss of other ions from the body, these medicines are given for the treatment of hyperkalemia, as well as medicines are given for hypercalcemia. Two drugs belongs to this class. One is known as furosemide. The second drug is torsemide. And what is the contraindication of this medicine? So contraindication is only one. If the patient is sulfur drug allergic, these medicines are contraindicated. Patient is a sulfur drug allergic, these medicines are contraindicated in those patients. Otherwise, these medicines are wonderful drugs to be used. Now, if we talk about next topic, medicines which will act on early DCT. Now, if we talk about early DCT, from this portion of kidney, that is early DCT, only ions are absorbed. Only ions are reabsorbed. The water is not reabsorbed. We discussed this point. That is a very, very important point over here. Early part of DCT, only ions are reabsorbed. Only ions are reabsorbed from this part. So early part of DCT, only ions are reabsorbed. The water is not reabsorbed. So thiazides are the drugs which will act over here, and they are inhibitor of sodium chloride pump. So thiazides are inhibitor of sodium chloride pump, and by inhibiting sodium chloride pump, these medicines will cause loss of sodium from the body, but water is not lost. And because only the sodium is lost, 5 to 10% of sodium is lost, so these medicines have maximum risk of hyponatremia. So guys, try to understand, although the maximum loss of sodium is by loop diuretic. So loop diuretics will cause 20% of sodium loss, but thiazides will cause only 10% of sodium loss, that is half of that. So thiazides will cause 10% of sodium loss, but loop diuretics will cause 20% of sodium loss. But still, thiazide drugs have more risk of hyponatremia because these medicines will only cause loss of sodium without the loss of water. So if a patient is suffering from hypernatremia, that is diabetes insipidus. So hypernatremia is a condition where the patient will have diabetes insipidus. So diabetes insipidus is a condition where patient will have ADH underactivity. So patient will have ADH underactivity. So when the ADH is not functioning, patient is losing the water. Patient is losing the water from the body, and when the patient is losing the water from the body, the sodium is not getting lost. Patient suffer from hypernatremia. So patient will suffer from hypernatremia. The condition is diabetes insipidus. So thiazides are the drug of choice for nephrogenic diabetes insipidus. Thiazides are drug of choice for nephrogenic diabetes insipidus, or they are useful for the treatment of diabetes insipidus. Apart from that, thiazides will cause loss of sodium, not the water. And if the sodium is lost from the body, the motor nerves, the sympathetic nerves cannot act properly. When the sympathetic nerves cannot work properly in presence of hyponatremia, the sodium is required for nerve conduction, nerve depolarization. If the sodium is not there, the nerves cannot work properly, the sympathetic nerves cannot work properly, so the blood vessels will get dilated. The nerves, the motor nerves, the sympathetic nerves cannot act on alpha receptor, and the blood vessel tone will not be maintained. Blood vessels get dilated, and thiazides are given as first line drug. Thiazides are given as first line drugs for maintenance treatment of hypertension. So thiazides are given as first line drugs for maintenance treatment of hypertension, and the drugs which belong to this class, the medicines names are chlorthalidone and indapamide. So the medicine which we discussed here was chlorthalidone and indapamide. So chlorthalidone and indapamide are two medicine. We made a mnemonic Indian thali. So Indian stands for indapamide, thali stands for chlorthalidone. So Indian thali, or from South India we made the mnemonic Indian thalaiva. So Indian thalaiva is best, or Indian thali is best. So chlorthalidone or indapamide are the best thiazides which we use nowadays for hypertension. Whenever we give thiazide diuretics, these medicines will increase the action of PTH. So parathyroid hormone action is improved. So whenever we give thiazides will cause loss of sodium, and when we lose the positive charge, from the body, then at this point, that is early DCT, at this location of kidney, that is early DCT, one hormone, that is parathyroid hormone. So parathyroid hormone is one hormone. So that hormone, as a compensatory mechanism, will start retaining more calcium. So thiazides will cause loss of sodium, and when thiazides will cause loss of sodium, as a compensatory mechanism, the parathyroid hormone at this location will start retaining more calcium, and therefore we can use this medicine for the treatment of hypocalcemia, and all calcium of the kidney is shifted towards the plasma. So we can also use this medicine for the treatment of nephrocalcinosis or the renal stone. So medicines are given for the treatment of renal stones or nephrocalcinosis because all calcium is shifted towards the plasma. No calcium is left in the kidney, because when you give thiazides will act on early DCT. In early DCT, medicine will not lose water, medicine will only lose sodium, and if patient will develop hyponatremia, patient develops sodium deficiency, the parathyroid hormone, which is also active at the same place, will start retaining the other positive charge as a compensatory mechanism, that is calcium. Right now, medicine has the same contraindication as loop diuretic. So contraindication is the same if the patient is sulfa hypersensitive. So if the patient is sulfa hypersensitive, these medicines are contraindicated. So contraindication is same. If the patient is sulfa hypersensitive, we will not give this medicine. Now, what are the side effects of this drug? Now that we discussed that side effects of these medicines are same as loop diuretics. So just like loop diuretics, all ions are lost, plus neurotoxicity, ototoxicity, plus metabolic side effect like hyperglycemia, hyperlipidemia, hyperuricemia, but there is no loss of calcium and there is no calcium stone formation. So medicine will not cause loss of sodium, and we made a mnemonic that loop diuretics are having the word LOO. So lose stands for lose calcium. So loop diuretics will lose calcium, but thiazides will help in retention of calcium. So thiazides will help in retention of calcium, but loop diuretics will cause loss of calcium. Now we have the next location, the late DCT and cortical collecting ducts. So late DCT and cortical collecting drug, the medicines are known as potassium sparing diuretics. Medicines are known as potassium sparing diuretics. Why we call them potassium sparing diuretics? Because if we go from left side to right side, carbonic anhydrase inhibitor, mannitol, loop diuretic, thiazide diuretic, all these medicines will cause hypokalemia, but only this group of medicine will retain the potassium in the body. That's why we call them potassium sparing diuretics. So all diuretics before this loses potassium and therefore causes hypokalemia. Now this group of medicines will cause hyperkalemia. Now there are two types of medicines, two group of medicines are there. First is the drug which is blocker of ENaC. So we have a presence of a pump over here, ENaC. So ENaC blocked by amiloride. So the drug which is blocker of ENaC, the drug name is amiloride. And we have a very important drug over here which is blocker of aldosterone receptor. That is a drug blocker of aldosterone receptor. The drug is known as aldosterone receptor antagonist. The drug name is spironolactone. So spironolactone is a drug which is aldosterone receptor antagonist over here. So aldosterone receptor antagonist, the drug name is spironolactone. The medicines will cause retention of potassium. So very important side effect of the medicine is hyperkalemia. So these medicines will cause hyperkalemia plus the spironolactone. We discussed that spironolactone is a drug which can also cause deficiency of testosterone in the body. So spironolactone can also cause deficiency of testosterone in the body. So this medicine can cause gynecomastia as one of the side effect. So one of the side effect of this medicine is gynecomastia. So spironolactone is a drug. This medicine can cause gynecomastia as an important side effect, which they have asked already so many times in your exam. So two important side effects which you have to concentrate. One is hyperkalemia. The second is gynecomastia. Apart from that, these medicines can lose sodium, that is very mild. So sodium loss is very mild, and medicines can also cause acidosis because of the retention of potassium, but because retention of hydrogen. So these two side effects are not important for your exam, but the other two are very important. Medicines can cause hyperkalemia and gynecomastia. Now where do we use this potassium sparing diuretic or ARA? So if we talk about indications of only ARA, so where do we use this medicine, spironolactone? So please remember, these medicines are drug of choice for Conn's syndrome. So Conn's syndrome is hyperaldosteronism. So patient is already having hyperaldosteronism, aldosterone level is already high. These medicines are drug of choice. These medicines are given for CHF to prevent the remodeling. The remodeling is due to the RAS pathway. Remodeling is due to the RAS pathway overactivity. So the medicine which is blocker of this RAS pathway, that is aldosterone receptor blocker, are given for the treatment of CHF. So medicines are given for the treatment of CHF also. Plus, apart from that, medicines are given for the treatment of resistant hypertension. So medicines are given for the treatment of resistant hypertension also. So drug is given for the treatment of resistant hypertension. So medicine is given for the treatment of resistant hypertension. And what is resistant hypertension? Resistant hypertension is the one, let me write it correctly. Resistant hypertension is the one which is not controlled by 3 first-line drugs which patient is already taking. So 3 first-line drugs which patient is already taking, medicines are not indicated for that. Hypertension that is not controlled by 3 medicines which patient is already taking, and these 3 medicines are ACE inhibitors. These 3 medicines are ACE inhibitor, calcium channel blocker, and thiazide diuretic, which are the first line drugs. But even then BP is not controlled, that is known as resistant hypertension, and aldosterone receptor antagonists are given as a 4th drug for that. Apart from that, spironolactone is a drug which can block testosterone in females and given for the treatment of hirsutism as a first line drug. Apart from that, spironolactone is drug of choice. Spironolactone is a drug of choice for ascites and edema that is seen in patients of nephrotic syndrome. So in patients of nephrotic syndrome and ascites, whatever edema occurs, we use spironolactone as a drug of choice. So spironolactone is a drug of choice for edema associated with ascites and nephrotic syndrome. Apart from this, this medicine is given along with loop diuretics. Medicine is given along with loop diuretics to prevent hypokalemia. So along with loop diuretics, medicine is given to prevent hypokalemia. So to prevent hypokalemia, these medicines are given along with loop diuretics. So to prevent hypokalemia, medicine is given to prevent the loop diuretics. To prevent the hypokalemia, given along with loop diuretics. Now, what is the side effect? Side effects we have covered already. Hyperkalemia and gynecomastia. Contraindication. In which condition these medicines are not given? So please remember, medicines are not given in conditions where the patient is already having the hyperkalemia, that is CKD. So in patients of CKD, medicines is avoided, because in CKD patient already there is hyperkalemia, medicine will cause more hyperkalemia, right? Then we have the last group of medicines, the medicines which will act on medullary collecting duct. So in medullary collecting duct, we have the presence of ADH action. So ADH is a hormone which will act on medullary collecting duct and block the and act on vasopressin 2 receptor, retain the water. So we have a drug which is V2 receptor blocker. We have a medicine which is V2 receptor blocker. The drug name is tolvaptan. So tolvaptan is vasopressin 2 receptor inhibitor, and this medicine which is vasopressin 2 receptor inhibitor, this is considered as drug of choice for ADH overactivity. This is considered as drug of choice for ADH overactivity. It's a drug of choice for SIADH. So tolvaptan, which is already having the word vaptan, the vaptan stands for vasopressin. So it's a vasopressin antagonist. So this medicine is vasopressin antagonist. The drug is tolvaptan. It's a drug of choice for SIADH. This is what we have discussed on medullary collecting duct. So this is the whole summary of this kidney topic. Although it's not very neat and clean, but when we discussed, I think you people have understood this topic of kidney, right? So drug of choice for different types of edema. For cerebral edema, drug of choice is mannitol. And edema inside the eye, that is angle closure glaucoma, we use acetazolamide for that. So edema inside the eye, that is angle closure glaucoma, we use acetazolamide. But we have periorbital edema. Edema around the eyeball, around the eye, that is CKD associated edema. Furosemide is drug of choice. CHF with pulmonary edema, furosemide is drug of choice. Acute CHF with pulmonary edema, furosemide is drug of choice. Ascites and nephrotic syndrome edema. Edema due to nephrotic syndrome and ascites, spironolactone is a drug of choice. And for pedal edema, we prefer to use torsemide. For pedal edema. We have discussed about this topic kidney, and I think I forgot to tell you the importance of this kidney topic. One MCQ will be asked, and most of the time they ask questions from carbonic anhydrase inhibitor. So carbonic anhydrase inhibitor is important, and thiazide topic is important. Carbonic anhydrase inhibitor and thiazide topics are important for this kidney. Okay. So next topic is cardiovascular system. So before this break, we discussed about three: autonomic system, respiratory system, and kidney. Next is cardiovascular system. Now from this cardiovascular system, 3 MCQs will be asked, and 2 MCQs will come from antihypertensive drugs. So 2 MCQ will come from antihypertensive drugs treatment, and 1 MCQ will come from CHF. So these two topics are important. Total 3 MCQs will be asked. 2 MCQs from hypertension and 1 MCQ will come from CHF. So let's start with first topic. Medicines which are given for hypertension. So the drugs which are given for hypertension, we can divide these medicines in 4 groups. Number 1, so diuretics are useful for hypertension. Autonomic drugs are given for hypertension. RAS pathway inhibitors, the drugs which are inhibitor of renin, angiotensin, aldosterone system given for hypertension. And the last is vasodilators, also given for hypertension. Now the first topic is diuretics. So this topic we have already covered. Three group of diuretics we use for hypertension. One is loop diuretics. So loop diuretics, thiazide diuretics, and aldosterone receptor antagonist. So please remember, loop diuretics are given for hypertensive crisis treatment. Loop diuretics are the strong diuretics. We use them for hypertensive crisis, but we do not use them for maintenance treatment. Otherwise, there is a high risk of dehydration and immediate death. And the drug which we use for hypertensive crisis is Lasix. Lasix is a brand name of a drug known as furosemide. If we talk about thiazides, thiazides are used as a first line drugs. They are used as a first line drug for maintenance treatment of hypertension. We have already covered thiazides will act on early DCT, can result in loss of 5 to 10% of sodium, and due to that reason, when the sodium is lost, patient develops hyponatremia. And in presence of hyponatremia, your motor nerves, your sympathetic nerves will not be able to act properly, and that is the reason when the motor nerves or sympathetic nerves will not act properly, your blood vessels will get relaxed, the blood vessel tone will be reduced, and drugs are used as a first line drug for maintenance treatment of hypertension. We made a mnemonic that Indian Thali is best. So two drugs, that is indapamide and chlorthalidone, given for the treatment of hypertension. Aldosterone receptor antagonist given for resistant hypertension. Spironolactone is a drug. This resistant hypertension is the one where the patient disease is not controlled even after giving the three medicines together. So that is resistant hypertension, and spironolactone is given for that. Two important side effects of spironolactone are hyperkalemia, because it's a potassium sparing diuretic, and also causes gynecomastia. Next group of medicine that we use for hypertension is autonomic nervous system drugs. So autonomic nervous system drugs, the medicines are alpha blocker, which we use. Number two, we have beta blockers, which we use. And number three, the medicines are known as alpha 2 agonist. So if we talk about alpha blockers, there are three alpha blockers. Total medicines were 4 in alpha blocker topic. Three medicines starts with alphabet P, and one was tamsulosin, if you remember. So three medicines which start with alphabet P. One is prazosin. It's a drug of choice for hypertensive crisis associated with scorpion sting. Second drug was phentolamine. Phentolamine, drug of choice for cheese reaction. We discussed the mnemonic, Fenta and cheese should always be consumed together. Third was phenoxybenzamine. So phenoxybenzamine is a drug. We discussed that this medicine is having the word ban. So this medicine will ban the alpha receptor by making the covalent bond with the alpha receptor and block this alpha receptor irreversibly. And it will also ban the tumor. So the drug which will ban the alpha receptor also ban the tumor. Pheochromocytoma, drug of choice phenoxybenzamine. Beta blocker we discussed. There are three generations of beta blocker, generation 1, 2 and 3. And generation 1 medicines are not given for cardiovascular indication, and generation 2 and 3 medicines are given for hypertension. So generation 1 medicines are not given for hypertension, generation 2 and 3 medicines are given for hypertension, because generation 1 medicines can cause vasospasm and bronchospasm as two side effects. Two medicines in beta blockers that we require to discuss in hypertension topic, they are the drug of choice for some condition. For example, labetalol. Labetalol is a drug of choice for PIH. So whether the female requires maintenance treatment or female is in hypertensive crisis. So pregnant female who is in hypertensive crisis or she requires maintenance treatment, labetalol, which is a generation 3 medicine, block alpha and beta receptor together. It's a drug of choice for PIH. We have esmolol. Esmolol is a drug. It's a drug of choice for hypertensive crisis associated with aortic dissection. Hypertensive crisis, the blood pressure is so much high that this high pressure has dissected the wall of aorta. The pressure of the BP, the pressure of this blood is so much high that it had dissected the wall of aorta. We call it aortic dissection, complication of hypertensive crisis. So esmolol is drug of choice for that type of hypertensive crisis. We have alpha 2 agonist. So there are two locations of alpha 2, and alpha 2 is a type of inhibitory receptors. So one of the location of alpha 2 receptor is CNS. So medicines will take entry in CNS, and after taking entry in CNS, medicines block the vasomotor center, and by blocking the vasomotor center, drugs can control the hypertension. Two medicine we discussed, clonidine and alpha methyl dopa. Both medicines are given for PIH, and alpha methyl dopa is considered as second drug of choice. It is considered as second drug of choice for maintenance treatment of PIH. The drug of choice for maintenance treatment of PIH is labetalol, but methyl dopa is a second drug of choice. And why not this medicine has become the drug of choice? Because of the reason that we discussed already in the previous topic, that this drug can cause antibody induction, and because of induction of antibody, this will cause autoimmune hemolytic anemia and can result in SLE-like reaction. Now we have third group of medicine that will act on RAS pathway. Third group of medicine that will act on RAS pathway. So full form of RAS pathway is renin, angiotensin, aldosterone system. So three group of medicines will act over here. Number one is renin inhibitor. The drug is renin inhibitor. So just remember its name, aliskiren. So first group is renin inhibitor. Remember its name, renin aliskiren. So in aliskiren, this REN stands for renin, and this I stands for inhibitor. So this medicine is direct inhibitor of renin. So aliskiren is a drug which is a direct inhibitor of renin. It's a renin inhibitor. Now apart from that, we have two more group. One is known as ACE inhibitor. So ACE inhibitors are the drugs which end up with the word pril. ACE inhibitors are the drugs which end up with the word pril. And we have angiotensin receptor blockers. And angiotensin receptor blockers are the drugs which end up with the word sartan. So angiotensin receptor blocker ends up with the word sartan, and ACE inhibitor ends up with the word pril. So ACE inhibitor ARBs are pril and sartan. Now where do we use this medicine? Now these medicines are the first line drug for maintenance treatment of hypertension. If you look at here, thiazides are considered as first line drugs of hypertension. Now ACE inhibitors are also preferred as first line drugs for ACE inhibitor. So two groups are here, ACE inhibitor and ARB, and for all indication, ACE inhibitors are always preferred over ARB. ACE inhibitors are always given as a first drug. If the patient cannot tolerate ACE inhibitor, then only we give ARB, otherwise we only give ACE inhibitor. So they are the first line drug for maintenance treatment of hypertension. These medicines are also drug of choice for diabetic nephropathy, or we can say albuminuria. Now these medicines are also given for maintenance treatment of CHF. We use these medicines for maintenance treatment of CHF, and in maintenance treatment of CHF, these medicines are given to prevent remodeling. These drugs are given to prevent remodeling. And the best medicine here which is given to prevent remodeling, the drug that will maximally reduce the mortality in patients of CHF, or the medicine which will maximally improve the survival in patient of CHF, the group name is ARNI. So ARNI is a drug group. It's a combination of two drugs. So what is this ARNI? The drug is ARNI. Now ARNI is a drug which is a combination of valsartan. So this medicine is a combination of valsartan plus sacubitril. So ARNI is a combination of valsartan plus sacubitril, where valsartan is angiotensin receptor blocker and sacubitril is a drug which is neprilysin enzyme inhibitor. Now this combination is a wonderful combination that will cause maximum reduction of mortality in patients of CHF. So in patients of CHF, there are total 5 group of medicines. There are total 5 group of medicines which can reduce the mortality. The best is ARNI. So this whole topic is important for your this year exam. Now apart from this ARNI, which other drugs? Apart from this ARNI, which other drugs we can use for prevention of remodeling? So after ARNI, you people are supposed to mark ACE inhibitor, and if ACE inhibitors are not given in MCQ, you will go for ARB. If ARBs are also not given in MCQ, you can go for ARA or beta blockers. So this is a sequence of drugs which can reduce mortality in patients of CHF. The best is ARNI. After ARNI, the other drugs are ACE inhibitor, ARB, ARA and beta blocker. ACE inhibitors are angiotensin converting enzyme inhibitor, ARBs are angiotensin receptor blocker, and ARA is aldosterone receptor antagonist. Now, apart from that, there is a drug losartan here. Losartan is a type of ARB, angiotensin receptor blocker, which is also given for the treatment of gout because of its uricose-uric property. So losartan has uricose-uric property. It can eliminate uric acid from the body, given for gout, and also this medicine has anti-platelet property. Now we have a drug here, telmisartan. Now telmisartan is a drug which has anti-diabetic property. So this medicine will act on PPAR gamma receptor. Medicine will act on PPAR gamma receptor, and by acting on PPAR gamma receptor, this medicine can cause glucose uptake in the body, and medicine is having the anti-diabetic property. So all these are indications of this medicine. Now we discuss that all these drugs are prodrugs. All ACE inhibitors and ARBs are prodrug except two medicines which are not prodrug. So which two medicines are not prodrug? One is known as captopril. So captopril is not a prodrug, and one is lisinopril. So captopril and lisinopril are two medicines which are not prodrug. These medicines are given in active form. Now what are the side effects and contraindications of ACE inhibitor and ARB? Now whenever we give ACE inhibitor and ARB, the mnemonic of side effects and contraindication is captopril, where C stands for cough. We discussed that C stands for cough, A stands for angioedema. C and A is cough and angioedema, and this is due to the excess of bradykinin. This is due to the excess of bradykinin and only seen with ACE inhibitor. This side effect is only seen with ACE inhibitor. The side effect is not seen with ARB. So cough and angioedema are two side effects which are seen only with ACE inhibitor, not seen with ARB, and the reason is increased level of bradykinin. So ACE inhibitors are associated with increased bradykinin, but ARBs are not. In this mnemonic, P stands for hyperkalemia, increased potassium. T stands for taste change. O stands for orthostatic hypotension. Now there are three contraindications of this medicine. One is pregnancy. Second is bilateral renal artery stenosis, and I stands for increased level of serum creatinine more than 2.5. So pregnancy, renal artery stenosis, and increased level of serum creatinine more than 2.5 are three contraindications which are back to back. And L stands for lal rash. So whenever we give the medicines can cause lal rash or skin rashes all over your body. So again I am repeating, this is cough, angioedema, hyperkalemia, taste change, orthostatic hypotension, pregnancy, renal artery stenosis bilateral, increased level of serum creatinine more than 2.5, and lal rashes are the side effects and contraindications of ACE inhibitor. Right? Now one thing we have forgotten to add over here, that there is one drug here, the drug name is enalaprilat. So in this notes, one drug is missing, enalaprilat. So guys, I request you that you read enalaprilat. Now enalaprilat is a drug which is the active form of enalapril. Enalaprilat is a drug which is the active form of enalapril, and that medicine we use for hypertensive crisis. Understood? So what are the indications of ACE inhibitor and ARBs? So these medicines are given for maintenance treatment of hypertension, and enalaprilat, which is the active form of enalapril, is given for hypertensive crisis. These medicines are also given for diabetic nephropathy as a drug of choice. They are also given for maintenance treatment of CHF to prevent the remodeling or to reduce the mortality. The 5 medicines which can reduce the mortality and remodeling are ARNI, ACE inhibitor, ARBs, ARA, and beta blockers. Losartan is a drug that is given for gout as well as antiplatelet drug. Telmisartan we can use as an anti-diabetic which will act on PPAR gamma receptor. Now all these medicines are prodrug except captopril and lisinopril, which are not prodrug. And side effects and contraindication we can remember by a mnemonic captopril, where cough and angioedema are two very common side effects which are seen only with ACE inhibitor, not seen with ARB, because these ACE inhibitor will result in retention of bradykinin. The last group of antihypertensives. So three group of antihypertensives we have covered. Diuretics we have covered, where we discuss about loop diuretic, thiazide diuretic, and ARA. ANS drugs we have covered, where we have covered about alpha blocker, where we discuss 3 Ps. 2 beta blockers we covered, labetalol and esmolol, and the medicines which act on alpha 2 receptor like methyl dopa clonidine we have covered. Medicines which are blocker of RAS system, aliskiren, direct renin inhibitor, and other 2 groups are ACE inhibitor and ARBs. The fourth group of medicine that we use for hypertension is a vasodilator group. Now in vasodilator, the phenol-dopam. If you remember phenol-dopam, today we have discussed, or today we have again covered in a topic of catecholamine. It is one of the synthetic catecholamine, artificial catecholamine. So 6 catecholamine we have covered, 3 were natural, 3 were artificial. So phenol-dopam was a artificial catecholamine that is given for hypertensive crisis with oliguria. We have some drugs which are donor of nitric oxide. There are some drugs which are donor of nitric oxide and vasodilators, used as a vasodilator. The most efficient, the strongest vasodilator available in the market is nitroprusside. So sodium nitroprusside is the drug which is the most potent, strongest vasodilator available in the market. It's a drug of choice for intraoperative crisis. Right? It's a drug of choice for intraoperative crisis or the hypertensive crisis that occurs during surgery. Now, whenever we give this medicine in high dose, this medicine can cause cyanide toxicity as a side effect. So nitroprusside, the important side effect is cyanide toxicity, and the antidote of choice for cyanide toxicity is vitamin B12, or we can call it hydroxycobalamin. So the antidote of choice is hydroxycobalamin. So antidote of choice is hydroxycobalamin, also known as vitamin B12, which is used as an antidote of choice for cyanide toxicity. Now apart from that, we have some drugs which are potassium channel opener, and we made some mnemonic during our lecture. Potassium channel opener, one mnemonic was MDH masala, that is minoxidil, diazoxide or hydralazine. And we also make one more mnemonic. When I went to South India, we made this mnemonic like this way: HDMI port. So we make the mnemonic as HDMI port, and in this mnemonic of HDMI port, HI stands for hydralazine, DI stands for diazoxide. So HI stands for hydralazine, DI stands for diazoxide, MI stands for minoxidil. So 3 medicines are here: hydralazine, diazoxide and minoxidil. These medicines are potassium channel opener. So port means potassium channel opener. So 3 medicines are here. Now out of these medicines we have covered already that minoxidil. Minoxidil is no longer used as antihypertensive. We use this medicine mainly as a drug for androgenic alopecia. So this is the drug of choice for androgenic alopecia, and the drug which is diazoxide. So diazoxide is a medicine. Diazoxide is a medicine that we use for insulinoma, and the third medicine is hydralazine. Hydralazine is a drug which is considered as second drug of choice for hypertensive crisis in PIH. So hydralazine is second drug of choice for hypertensive crisis in PIH. What is the drug of choice for hypertensive crisis in PIH? Answer was labetalol. We have covered over here. So labetalol is drug of choice for crisis, but hydralazine is second drug of choice, right? And we have discussed that hydralazine is a drug which can also lead to SLE like side effects. So the second drug of choice for maintenance treatment was methyl dopa. So methyl dopa can also cause SLE, and hydralazine, which is the second drug of choice for crisis, also result in SLE. Now the main group of vasodilator which we discussed during our lecture was calcium channel blockers. So medicines are calcium channel blockers, were the wonderful vasodilators. Now these medicines we can divide in 2 groups. We have some old calcium channel blockers, we have some new calcium channel blockers. Now the old calcium channel blockers are, the example of old calcium channel blocker is verapamil. Now verapamil is the only calcium channel blocker which is nowadays used as an anti-arrhythmic drug. We will not use this medicine as an antihypertensive. We use this medicine more or less as an anti-arrhythmic drug, and as per the anti-arrhythmic classification, verapamil or the calcium channel blockers are class 4 anti-arrhythmic. These medicines are class 4 anti-arrhythmic drug. The drug name is verapamil. Now when I give this medicine as an antiarrhythmic, this verapamil will inhibit the nodal depolarization. The nodes of the heart are depolarized with the help of calcium ion. So these nodes cannot be depolarized if I give verapamil. So nodes are depolarized with the help of calcium ion. So if I block the calcium, the nodes cannot be depolarized. So I can use this medicine as a second drug of choice for nodal arrhythmias. For example, sinus tachycardia, that is a arrhythmia from SA node, and PSVT, that arrhythmia that starts from the AV nodal junction or AV node, right? We discussed already in a previous topic that sinus tachycardia का drug of choice है beta blocker. Second drug of choice is verapamil. For PSVT, the drug of choice we will discuss later on, but here we are discussing the second drug of choice for PSVT is verapamil. Now, the most common side effect of verapamil is constipation. I suggested you to take the verapamil to feel the side effect also. So, verapamil side effect is constipation, and because this medicine has negative effect on the heart, this medicine can reduce the muscle contraction. So, cardiac muscle contraction is reduced, and that will reduce cardiac output. So, this can reduce the cardiac output, and therefore, this medicine is contraindicated in patients of CHF. So verapamil has 3 MCQ. Number 1 MCQ, its indication. So medicine is used as an antiarrhythmic, class 4 antiarrhythmic given for sinus tachycardia and PSVT. The side effect of this medicine is constipation, and contraindication of this medicine is congestive heart failure. Now we have some new calcium channel blockers which end up with the word dipin. Now these new calcium channel blockers are very strong vasodilators. So wherever you want to dilate the vessel, if the patient is suffering from any disease, wherever you want to dilate the vessels, these calcium channel blockers are always considered as drug of choice. For example, they are the first line drugs for maintenance treatment of hypertension. So what are the 3 drugs which are the first line drugs? We discussed, if we go back to the classification, one is this thiazides, which are the first line drug. Second is this ACE inhibitor ARBs, which are the first line drug. And the third one is now dipins, which are considered as first line drug for hypertension. And amlodipine is a drug which is most preferred out of all. Now we have a dipin, which is a drug of choice for hypertensive crisis. The drug name is nicardipine. We have one more dipin, nimodipine. It is given for subarachnoid hemorrhage as a drug of choice. And we have a nifedipine, which is a drug of choice for preterm labor. And we made a mnemonic. 3 medicine starts with NI. Nifedipine is having the word FE. It's given for fetal problem, preterm labor. Nimodipine is having the word MO. It is given for meninges problem, subarachnoid hemorrhage. And nicardipine is having the word cardio. So it is given for hypertensive crisis. So 3 calcium channel blocker which starts with alphabet NI. Nifedipine, nimodipine, nicardipine. Nifedipine for preterm labor, nimodipine for subarachnoid hemorrhage, and nicardipine for hypertensive crisis. Now apart from that, these vasodilators are also drug of choice for Raynaud's disease. Apart from that, these medicines are also given for vasospastic angina.